Okay. Hi, my name is Margaret Kirby, and today I'm talking with William Cockburn Salazar from EU-OSHA, the European Agency for Safety and Health at Work. So, good morning, William. How are you today?
Good morning, Margaret. Really well, and it's a great pleasure to be with you today.
Thanks very much. So, we are going to talk about the work of EU-OSHA, William, and your role in the agency and how it impacts on the work of the health and safety practitioner in Ireland. So I believe you are with the agency over 25 years. Is that right?
That's right. Time flies.
Okay.
I joined EU-OSHA in 1998, just a couple of years after it had started work here in Bilbao, northern Spain.
Okay, okay. And just tell me a bit about your background, William. Where did you grow up, or do you speak different languages?
Well, as you can probably hear from my accent, I grew up in England and studied and went to school there and worked until I came here, aged 30. But at home, I grew up in a dual nationality household. My mum's Spanish. She's actually from here, from Bilbao. My father's English. So I grew up speaking Spanish as well. And well, I mean, I've got a good level of French as well, and that is useful for the work here at EU OSHA. It's handy to be able to communicate in different languages for work, and also, of course, for living here in Bilbao.
Okay, very good. Okay, so you had a bilingual household growing up, is that right?
That's right. That's right.
Yeah,
Bicultural, I'd say.
bicultural. Okay, right. Okay. And did your parents communicate in one language separately to you, or how did you do it as a household?
Well, we also lived with my Spanish grandma, and she would never really
Okay,
learn that much English. So
yeah,
certainly half of the conversation was in Spanish. Um, and although, when you're growing up, sometimes you don't want to be so different. So we'd reply in English for a number of years. I say we as my sister and I.
yes.
After a while, we realized that it was much more sensible to be able to speak a different language, and then we started speaking Spanish as well.
Okay, fantastic. Yeah, it's certainly an advantage, I think, growing up in that type of household where there's exposure to different languages that makes it much more natural, doesn't it?
It is, it is. There's
Yeah,
also challenges. So, when your grandma plasters your hair down with eau de cologne and you try and explain to your schoolmates that that's not perfume, that
okay.
creates some challenges.
Okay. Okay, okay. I'm sure it does actually. Well, yeah, that's very interesting background. And I suppose really as you work in EU OSHA now for this length of time, the question is where did your interest for health and safety come from? Did something spark it?
Well, I studied law first, and there, after realizing perhaps I didn't want to be a lawyer, uh, took a master's degree in ergonomics, and that's really where my interest was sparked into
Okay.
safety systems, health and safety, looking into accident research, and from there. I started doing research. I started a PhD on tools for measuring safety climate and safety culture. So that's really where the interest in health and safety started.
Okay, very good. The Masters in Ergonomics, that's a really interesting course, I imagine. And I suppose since the pandemic, William, there was a move towards remote assessments for display screen equipments in people's homes and houses. Did you have any thoughts on that?
Yeah, for sure. I
Yeah,
mean, it brought back a lot of memories around ergonomic assessment and
yeah,
really sort of nuts and bolts ergonomics, but broader human factors issues as well, about the organization
yes,
of work, about making sure that the job is designed to fit the person and the person doesn't have to adapt to the requirements of the job. And that's all the more relevant, of course, when you're not only changing the physical environment working from home, maybe suboptimal working conditions ergonomically, but also new arrangements,
yes.
different hours of working, different relationships, and so on. And a lot of that came into ergonomics and human factors.
Okay, okay. And did you actually do any work in ergonomics after your master's? You're saying?
Yes, as I say, I started a PhD, but then a job opportunity came up to work in human factors consultancy,
Okay,
and that was for a company that had been working for the UK Health and Safety Executive as a main customer, but also other private companies. And for example, I did a study there on looking at hearing loss, analyzing data for people working offshore. Also, we were looking at maritime safety, railway safety, and another part of that work was also managing the research program for health and safety executives. So that's really what got me into
okay.
research program management. So it was a good experience.
Okay, very good. Okay, that's great. I'm sure it's a big help in terms of your role at the moment, having that background as well as the legal background.
Yeah, I think it gives you a good perspective.
Yeah,
It's important to have a broad perspective in this area of ours, occupational safety and health, which is so multidisciplinary.
yeah.
I mean, here at the agency, we've got everything from chemists, toxicologists, psychologists, uh,
Okay.
the whole range. I mean, your practitioners will know that.
Yes, yeah. Okay, very good. That's very interesting. And I suppose the roles you had, you mentioned you did the PhD, and then you also worked in the consultancy role. Was there any other significant roles before you came to EU OSHA that you'd like to highlight?
No, that was pretty much it before joining here, the team in Bilbao, which was much smaller than it is now. But
Okay, yeah,
here I yeah came into the research department and was working there for quite a while.
okay. What year did you join, William?
I joined in 1998, so
Okay,
back then the
yeah,
agency was a bit smaller. As I say,
yeah,
we the agency had only started operating in Bilbao in 1996, so it's an exciting time to join the organization.
okay, yeah,
A lot of things were being done for the first time. We were working with the national focal points for setting up that national European network. It was an interesting time to be part of a new organization with such an interesting and ambitious mandate.
okay, very good. Okay, so it was pretty much in its infancy when you started.
That's
Yeah,
right. And
yeah,
it was a time when, as I say, we were also doing things for the first time. So setting up new research methods, new ways of working with the experts across Europe, and that was something that I was particularly interested in. And
yeah.
there, as I said, there that program management of research was useful. Right at the beginning, we had different topic areas, different topic centers that were like consortia of researcher institutes across Europe that
Okay,
worked on different issues. So we had one on dangerous substances, one on psychosocial risks, another one on research, and so on. It was that we've since then we've moved on to different ways of working, but that's how it was right at the beginning.
okay. It's interesting you even had psychosocial risks at that stage identified.
That's right. Yeah, really
Yeah,
from a very
yeah.
early stage, that was a priority at EU-OSHA. Yeah.
Okay, yeah. It's really hit the headlines now in the area of occupational health and safety, hasn't it? Psychosocial risks.
It has. I think it's widely recognized as one of the most challenging areas, and going alongside the general shift in jobs across the EU, where we're moving away from the more traditional jobs around manual tasks or manufacturing and industry, more towards the service sector, and as well as the introduction of new forms of work, new technology. The price workers pay is in mental health when these are not tackled properly. And I think
Yeah.
we can see across Europe how it's a greater issue in Northern and Central and Western Europe compared to Eastern and Southern Europe, where you still see accident and musculoskeletal disorders as cited as the main priorities.
Okay, okay. So Western Europe. has a higher prevalence of psychosocial risks. Yeah,
Certainly,
yeah,
that's the information we get back
we
from our
have.
data. Yeah.
Okay,
Yeah.
okay, great. And a question I like to ask people in this area is, did you have any mentors or anybody along the way that motivated you or inspired you in your career development?
Well, I had one friend who told me about ergonomics, and
Okay,
without his advice, I wouldn't have gone down that path. So that was a key person, and I think
okay,
I've
yeah,
had a number of. I think I've been lucky in having good bosses throughout my career, people who are
okay,
supportive, who are real role models. I'd maybe highlight the person who was my predecessor as head of research here at EU-OSHA, Dr. Eusebio Real Gonzalez, who unfortunately passed away some
okay,
years ago while still employed at the agency, because he was someone who
yeah,
was not only a real expert in the area of psychosocial risks, but also somebody who was very humble, very empowering, saw the best in people, and really also had fantastic insight in how to motivate and get the most out of a team, as well as, I say, being a great topic expert. I mean, he was a fantastic researcher at Nottingham
yes.
University and previously in the UK. So, yeah, a really inspiring person.
Okay, okay. So it sounds like you're very fortunate to have that person as part of your life experience.
Yeah, sure, for
Yeah,
sure.
yeah. It's not too often we come across people with all of those skills you just highlighted,
No,
especially the
no,
people skills as
extremely.
well.
Yeah, yeah.
Yeah, yeah. The ability to motivate and engage. It's a key part of the role of the health and safety practitioner.
That's right. That's right. I think you need to have this empathy to be able to connect with people, to be able to get them to carry out the actions that are clearly necessary, and that quality is not always there. So lucky when you've got someone like that in a responsible position, I think.
Yeah, okay, that's great. And I suppose moving on to your role now in EU OSHA and some of the work that you're involved in, is there anything you'd like to highlight, William, in terms of the work of the agency and how it is of value to health and safety practitioners?
Sure. I mean, I hope it's all relevant to some extent to health and safety practitioners, as they're a key intermediary, as we call them. Um,
Yes, yeah,
because we're only a relatively small agency. We're 65 people here in Bilbao, and we've got this ambitious mission to reach the workplaces throughout the EU. That's not something that we can do directly. So we rely on those bridging agents, those people who are intermediaries. So occupational safety and health practitioners are a key amongst those. Others would be the social partners, the labour inspectors, and so on.
okay,
Um, and I think the work that we do here, you could broadly describe in three areas. I mean, the first one is where we're carrying out research, collecting data, carrying out analysis to support policy making. So we're giving input to the legislative cycle, we're giving feedback on the success of different strategies and initiatives taken forward across Europe. The second area is where we're trying to more directly support prevention of risks in the workplace. And here we're identifying uh, good examples of tools and guidance, or developing our own tools and guidance,
yes,
and sharing them. So again, here, if we can put guidance and tools in the hands of OSH practitioners, then that's a real success. Um, we work closely in Ireland, for example, with the people in the HSA behind Be Smart, which is very close
yes,
to
yeah,
a tool that we have at European level called OIRA, and there's many common challenges. We developed guidance during the pandemic on working with COVID. There was enormous demand for that. And
yes,
more
yeah,
recently, a guidance on working in high temperatures, which has been very, very popular also. And just finally, the last area that we work in is raising awareness. And I think there as well,
okay,
we're supporting the work of practitioners, because we're great at talking within our own community, but it's so important that we get the message about occupational safety and health out more generally to the general public, to managers in general, and to policy areas beyond the employment area, so that we can get the proper resources and investment and priority given to occupational safety and health. So hopefully in that way we're also supporting the work of the practitioner.
Okay, yeah, those three areas, research is a big area for you because I know from even tracking some of the research reports that are published, William, they're always, I find, very well researched for one thing, also really relevant. And the one you just mentioned in terms of working in high temperatures, I recently looked at that and I was even thinking in Ireland that's becoming more relevant as our climate changes in line with the European and the worldwide climate. Because, we also, I suppose, experience high rates of um, people being exposed to UV radiation and skin cancer issues related to that. So it's becoming more and more relevant in Ireland as well. And the Pulse survey that you also did in 2022 had some very interesting, I suppose, items in it, focusing on Ireland again too. And there was some comments there around the impact of digitalisation and
That,
one, yeah, yeah. And there was, I think, some findings around some of the side effects of this can be an increase in working alone and the impact of loneliness that people experience because of this, and a feeling of being surveyed or, greater surveillance because of
yeah.
digitalization. Do you have any thoughts on that?
Yes, that's right. I mean, these comparative surveys that we carry out are really a major tool for us in the work we do. And as you say, we carried out this new survey, OSH Pulse, where we asked workers across Europe about their attitudes to occupational safety and health, their experience with digitalization, mental health, and psychosocial risks.
Yes.
And it's interesting to see the situation or the perceptions across Europe. And in the case of Ireland, I mean, the level of digitalization is really high. Um, so the experience of a high pace of work, the perception of isolation, of increased surveillance, workload, and loss of autonomy was reported high in Ireland compared to other member states.
Yes.
And we also see these aspects in our other main survey, which is the Essener survey, where we're asking the people in charge of health and safety in the workplace about day-to-day management. And we see also high levels of digitalization in Ireland there. The OSH Pulse, as I say, also looked at psychosocial risks and mental health. And here, the respondents in Ireland, again, were very much in the highest bracket as regards the reporting poor communication in the workplace.
Yes. Yeah.
Verbal abuse from customers, clients, or patients or pupils, and harassment and bullying. And I mean, the service sector is so strong in Ireland that it's not entirely surprising. There's a lot of people working with the public. There was also a perception that if you have a mental health problem, discussing that with your employer would be negative for your career. So that's something that I think practitioners need to be aware of, and something that needs to be worked on. On the other hand, I think Ireland was the country where workers felt that that prevention measures were most widespread.
Yes. Yeah.
They felt there were good measures in place. And I think Ireland had the highest level for recognizing awareness raising on OSH. So some good work there done by the OSH practitioners in terms of pushing the message on occupational safety and health.
Okay. Okay. Well, it's interesting you say that the prevention measures some of them were rated quite high in that survey, weren't they? I think reporting was one of those measures. There was a good level of reporting
Yeah,
and a good level of awareness raising activities as well. So it's not all negative. I suppose one of the takeaways I took from some of that research.
that's right. That's right. I think it's important to be aware of the challenges, but also see where the strong points are, and there were a lot of strong points there.
Yeah, okay, that's very good. And you touched on the importance, I suppose, of communication. That was highlighted also in the Pulse survey. Poor communication can be an issue for some workplaces. Have you any thoughts on that, William?
Yeah, where I mentioned this other survey that we carry
Yeah,
out, SNR, and we're asking there about day-to-day management of health and safety, how risk assessments are carried out, how psychosocial risks are carried out, how workers are involved, and what the barriers and what the motivators are. And when
yeah,
we dig into that data, we've been looking particularly as well at the situation of small businesses. They've got less resources, they've got less formal structures
yes,
in place, and
yeah,
really generally have more challenges in managing health and safety. There's no two ways about that.
yeah,
And I think what we see nearly always is that managers or owner managers, they really have the interests of their employees at heart. Whenever we're interviewing, the feedback you get is of course, this is like my family. I don't want to see anything happening to my workers, but there's very much there's a real reluctance to see a formal or a lack of awareness, not a reluctance, a lack of awareness about the benefits of taking a more formal approach. So there are issues that will not come up in conversations with employees unless you've got
yeah,
some structured, systematic approach to identifying those risks. And of course, OSH practitioners know this, but when we're looking at small and especially micro enterprises, there's this feeling that we're just a family, and if
yes.
anything was wrong, someone would come to me and would talk about it and would fix it. And of course, that's not the way it works in occupational safety and health. And surprises come, and problems need to be identified early on for the prevention measures to be taken.
Okay, okay. Yeah. So I suppose small businesses, it can be more of a challenge
Absolutely.
also. Yeah, okay. And looking at, I suppose, any other projects or research that the agency are involved in, is there any other research you'd like to highlight, William, that you think is particularly relevant going into 2024?
Sure, Margaret. How long have we got?
Well, we'll just do
No,
it maybe the top three.
sure.
The top three, maybe.
Um, we're focusing on a variety, sometimes on sectors. We've done some work
Yeah.
on agriculture, the future of agriculture, which is obviously
Okay.
important for a country like Ireland, looking at how the supply chain influences prevention in agriculture and construction, for example. Small businesses often don't have the resources to dedicate to occupational safety and health because they're focused on surviving week to week. So how do we deal
Yeah.
with organizations that are in this vulnerable situation? Um, Looking at outcomes, we're also focusing on the causes of cardiovascular disease. We're looking at psychosocial risks and mental health as well.
Okay.
Um, from a more sort of general analytical approach, we're also trying to make this information, the data, the survey data, the analysis more accessible. So we present that on an online dashboard. That's the OSH barometer. And I'd encourage you to have a look at that if you haven't
Okay.
already, because you
Yeah.
can very easily um, compare the situation across Europe, whether that's in terms of planning of occupational safety and health, regulatory approaches, strategies, or outcomes, or the organizations that are there. It's a real good one-stop shop.
Okay.
But
Very good.
looking particularly at the research, I'd also mention a third survey, and that's especially
Yeah.
relevant for Ireland, and that's the Workers' Exposure Survey on cancer
Yes.
risk factors.
Yeah.
So a new survey for us, a really big, really complex survey that we did for the first time last year. And because it's so big and complex, we could only do it in 6 countries. And one of those 6 countries is Ireland, where we interviewed, I think it was 2,500 workers about their job, about the tasks that they carry out. And then within this survey methodology, there's a special algorithm that's able to estimate the level of exposure to, I think it's 24 different cancer risk factors. Everything from working with, for example, formaldehyde or benzene to process generated, such as diesel exhaust fumes, or even, as you mentioned, exposure to ultraviolet, solar ultraviolet radiation. And we've only just presented the first results, but through this year now, 2024, we'll be going more in depth and presenting more data. So yeah, keep an eye out for that, because obviously Ireland has a special part there.
Okay, very good. And that survey has highlighted, I suppose, some interesting findings in terms of cancer risks, William, and I'm going to come back to that in a minute. You were talking about the cancer survey. It's really valuable information, I believe, for the workplace, because it gives them a focus in terms of what hazards now are very important when it comes to protecting worker health. And there's now evidence which shows which hazards workplaces should focus on. So, with the first set of results that have been identified, William, if I was a health and safety practitioner in a workplace now, with that information that has been released, have you any advice as to what I should do with that information?
It's maybe a little early to conclude on any sort of practical points now that would be specifically resulting from this survey.
Okay.
What I would highlight is that the survey is particularly valuable. I mean, there's other existing methods of estimating exposures to carcinogens in the workplace. But
Yeah.
why this survey is bringing new information that I think is ultimately relevant for the practitioner as well is that it's able to look at combined exposures. So
Yes.
we're looking at a number of different factors and asking about them at the same time. We're also accessing through this survey workers who wouldn't normally be picked up by the usual surveillance methods. So we'll be covering also self-employed, those in micro enterprises, people
Okay.
working in jobs that maybe wouldn't normally be under surveillance, like cleaners and so on.
Yeah.
And we can already see from the data that exposure to, for example, ultraviolet is by far the most widespread, and exposure to diesel exhaust fumes as well, quite widespread. But the levels are generally within that. The greatest proportion of workers are exposed at a low level, so maybe not
Okay.
so much of a concern on its own. Within other exposures, for example, to wood dust or crystalline silica, we're seeing far lower levels of exposure than ultraviolet and diesel exhaust. But within those, the proportion exposed to high levels is approaching 50%. So we're talking
Okay.
about very high numbers of workers. So I think when it comes to prioritizing prevention action,
Yeah.
and the survey also asks about preventive measures that are in place, so we can see how existing provisions regarding protection are being put into place in practice. There will be a lot of practical information for policymakers, but also for practitioners. But that'll have to come later on this year.
Okay. And perhaps if I was in a workplace where the hazards of wood dust, silica, outdoor work, diesel fumes were present, would it be good practice for me to review maybe my risk assessments around those and just focus more on the control measures and really, be confident that we have everything working as reasonably practical as we hope to have? Would that be a good first step anyway?
Well, that would be the first step for your employer. Obviously, if you're the
Yeah,
self-employed, then that's the way to go. But
yeah,
there are plenty of practical tools. In fact, we adapted a Swedish tool called the Chemi Guide, which is a very simple approach for small businesses to carry out a risk assessment on dangerous substances in the workplace. And that refers back to the hierarchy of controls. So if there's a way of eliminating that risk, maybe substituting the substance for one that's less dangerous, or making engineering controls or organizational measures, and avoiding just by default skipping to the last one, which is the use of personal protective equipment. So for sure there are plenty of steps that can be taken, and guides and tools available to help you do that.
Okay, that's very useful to remind us about that. Okay, so we'll move on to a campaign that I know is running from 2023 to 2025, your Healthy Workplaces campaign. And this is focusing very much on the digital era and safety with regard to that, William. And this campaign is running longer than 1 year, which I suppose shows the priority that is on digitalisation in the workplace. There's 5 priority topics. And would you like to expand on those a bit for people, to understand a bit more about them?
Sure, Margaret, absolutely. This is a real transformative issue for work, and one that we really need to pay attention to as an occupational safety and health community. We actually carried out a foresight, a forward-looking exercise on health and safety risks related to digitalization some years ago, and then we carried out 4 years of research on this topic. And out of that, as you say, came some key priority areas that we're now campaigning on. We're campaigning on those over the next 24 months. And those are on platform work, so work through online digital platforms, which we've seen grow enormously over the last few years. They still represent a relatively small proportion of employment, but we see that growing not only in terms of obviously food delivery and taxi driving, but also in the supply of domestic work, maintenance, handy jobs at home, and so on. So it's an important issue, and one that's under a lot of focus in Europe. Then another one is the automation of tasks. And going back to the ergonomics and the human factors, it's so important that the job is designed around the person carrying it out and not the other way around. So when we're automating tasks, whether that's a physical task or a cognitive task, it's so important to keep health and safety principles in mind. And we need to keep them in mind at the design stage. Then we've got another topic that we'll be looking at, and that's telework, remote work, hybrid work, and so on. And as we discussed earlier, the pandemic really showed us such a shift there that was dramatic in how quickly and how extensive it was. And it throws up, again, a lot of questions, a lot of challenges, and we'll be putting forward not only findings, but good practice and guides and information around managing telework. And the third priority area is on the use of digitalization, specifically artificial intelligence, in managing workers. So whether that is the sort of incentives and gamification that are used in platforms, or whether it's human resource analytics that are being used more and more to inform management decisions, this again is an area that is impacting on occupational safety and health. And it's important, again, when these systems are being introduced, when they're being designed, when they're being rolled out, those occupational safety and health principles have to be kept in mind. The final of the 5 areas is, we call it smart digital, and that's about using new technology like wearable monitors, virtual reality, augmented reality, how all this technology is going to help us in improving occupational safety and health. So a lot of tools there that will be available in the future that are useful for OSH practitioners. And I should say, across all of these, the digitalization technology is neutral. It's not good. It's not bad. It's all about how it's developed, how it's put into practice. That is the key principle.
Okay, okay. So it's interesting that you say it's not good, it's not bad, it's how it's put into practice. That's a really, really valid point. I recently attended a conference where speakers spoke about how to do a risk assessment of a site using AI technology, William. And it was fascinating because it involved pretty much using a mobile video to record the site and how it looked in that moment, and the information being zoomed up to the cloud, and the cloud beaming down. This is in my layperson's terms now,
Yeah.
beaming down the completed risk assessment to view using a screen technology, and then I suppose reviewing what was provided on the screen and then sharing it with the relevant people. And it was fascinating to see something like that in terms of health and safety and where this can go. And I suppose in terms of where it can go, the point you're making is making sure that it's considered in the design stage of any of these pieces of technology, whether it's the wearable app, whether it's the EHS software system that it might be used for recording incidents or near misses, whether it's the AI technology for doing
Hmm.
the online risk assessment. There's a lot of different variables at play really in terms of how we can impact on the human element, isn't there? That's what I
There
thought
is.
anyway when I was looking at that.
Absolutely, and there's enormous
Yeah,
potential. But there's one
yeah,
other aspect that's so important, and one that we hold very dear in occupational safety and health, and that's participation of the employees, of the workers.
yeah,
That's absolutely at the core. I mean, whether that is direct participation, involvement of workers in the workplace, or whether that is the social dialogue when we're talking about the regulations that we want to have in place to guide developments in occupational safety and health. And if you're setting up these sophisticated systems
yeah,
and you haven't involved workers or their representatives, they're not aware of what's happening, they don't know why this data is being collected, it's really unlikely that it's going to be successful. There's going to
yes,
be
yeah,
suspicion. There's going to be coping actions. It's much less likely to be a successful intervention if workers are not effectively
yeah.
participating in that occupational safety and health management. But I think this is preaching to the converted for OSH practitioners.
Yes, yeah, yeah. I think it's really great to emphasize that point, worker participation,
Mm.
engagement, consultation. There was a piece of research I read recently that actually confirmed what you just said, that people can be reluctant to engage in new technology if they're not fully aware of what the intentions of the technology is and how it can benefit them in their role. There can be an element of fear associated with that too. And
Absolutely.
I think
Yeah.
it's yeah, I think it's very important to, as you said, to consult, talk, and communicate with workers when anything like that is happening in the workplace. So I suppose moving on to the future in terms of any regulations or directives, the legal side of it for the health and safety practitioner, William, is there anything that you think should be emphasized in terms of new directives, regulations that is going to be important over the coming year or few years?
Sure. So, I mean, directives are the competence of the European Commission, and we support them with the evidence and then raising awareness and so on. At the moment, this year they'll be starting again the discussions on updating the directive on display screen equipment and the workplaces directives. That
Okay.
had already started last year, but those discussions were put on pause as the social partners were negotiating on telework and the right to disconnect. And if that agreement had been reached, then that would have had the force of regulation in Europe. That negotiation has paused, which means that the previous negotiation on display screen equipment and workplaces directive will start again very shortly. So
Okay.
we will see updates of those two important directives. The Commission has been updating now on a regular basis the legislation around dangerous substances, so chemical agents directive, the carcinogens, mutagens, and reprotoxic substances directive. So they're being updated in terms of substances, in terms of exposure limits.
Yes.
Last year, at the end of last year as well, a new directive on asbestos came into force with
Yeah.
2 years implementation period, again with far lower exposure limits, as well as some other changes. An interesting one for OSH practitioners as well, perhaps, is the directive on CSR, on corporate sustainability reporting,
Yes. Yeah.
entered into force at the beginning of last year. And this year, companies will have to apply these new rules for reports that will be published in 2025. So that means the work will be done this year. And that's covering, environmental, social, corporate governance, ESG. So those requirements, they're not affecting the smaller companies yet, but they're into force already.
Okay.
And
Yeah.
there are specific requirements there relating to health and safety of employees. And this year, again,
Okay.
there'll be discussions continuing on regulation of psychosocial risks, but certainly there's different practices across Europe, and the Commission will be leading discussions on this, but no proposals for regulation as yet.
Okay. Interesting. It is on the discussion table, the psychosocial risks. Yeah.
Yeah,
Okay.
very much so. Yeah.
Yeah. Okay. That's great. That gives us a good summary of some of the key areas to focus on. And I suppose challenges and opportunities. You did touch on those, I suppose, in relation to digitalization and communication in the workplace. William, is there anything else, I suppose, that as safety practitioners are starting into 2024 and they're thinking about, is there anything that could be useful in particular for them to be aware of, any particular challenges to prioritize in their workplace? Any advice you'd like to share from your own perspective?
I think we've discussed what we see as the main challenges in the year ahead coming from digitalization
Yeah.
and from mental health and psychosocial. I think that we need to be, we need to be aware that sometimes, although not under the control of employers, there are factors that are going to be making people more vulnerable, can I say? So, if we're going through a cost of living crisis, workers may be coming to work, with additional pressures, with reduced capacity for maybe taking on additional risks in the workplace. So
Yeah.
it's not a case of making employers responsible for these factors, but they need to be aware and they need to be sure that in the workplace there are not any factors that are going to be building on top of these issues to just push people over the edge. That can be in the area of musculoskeletal disorders. People can come to work with a number of different loads, but that doesn't mean that if somebody has back pain, it's nothing to do with work. I mean, you just need to be sure that you're also reducing the risks related to musculoskeletal disorders as far as possible in the workplace, and that goes for psychosocial risks and mental health. And I think this broader context of pressure coming from different areas
Yeah.
is something that needs to be borne in mind. And the most challenging area is psychosocial risks and mental health, I would say.
Okay. Okay. And one of the findings, I think, from the research is that there's a reluctance amongst employees to raise mental health issues with their employer in the workplace, William. And there can be different reasons for that also. Sometimes they can be fearful that it might lead to repercussions in relation to their role or future
Right.
promotion potential in the workplace. Is there anything that you could add to that to, I suppose, help inform employers? How can they make that discussion more possible, more open?
Well, that's
Because,
where
yeah,
I think on the one hand you need to show leadership. So if the manager is openly talking about these issues and making it quite plain the position of the employer, that this is something that needs to be spoken about, that it's not going to be eliciting a negative reaction, then
yes,
that's
okay,
crucial. I mentioned earlier the benefit of taking a systematic, structured approach of using the tools that are available, the guides. This can also help to take the heat out of, or the
okay,
sensitivity out
yeah,
of conversations. So
okay,
this more structured, systematic approach is the way to go. We also asked in that survey whether talking about mental health issues had become easier since the pandemic, and more than half
yeah,
of the workers, this is across Europe, said that it had. So just seeing the issue
yeah,
being spoken about in the workplace, in the media, um, personalities who are sharing their experience, it's all leading to, I think, a culture change around this area that's much needed. So I think we do see good progress. Um, and of course, sharing experiences, sharing tools, sharing guidance, good practice. It's something that's so easy to do these days, and that's at the core of what we do at EU-OSHA. So I think from that perspective, we'd like to remain optimistic.
okay, okay. I think what you just said is really, really helpful. Good leadership. That's a really valid point in terms of encouraging employees to bring forward topics or issues or, things that they may be reluctant to do otherwise. So thanks for giving us that pointer on that. So, William, I think we've covered what we were hoping to cover in this interview. So what I'm going to do in terms of the actual recording, I'm going to click stop on the recording and I'll just have a little conversation with you before we finish up. Is that okay?
Yeah, no problem. It's a
Thanks.
pleasure.
Okay, thanks.